Welcome to my channel. In this video we are going to see about muscles of anterior compartment of forearm. The muscles of front of forearm are generally divided into two groups, superficial group and deep group. Now let's see about superficial group. Superficial muscles of front of forearm includes from lateral to medial, pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, flexor carpi ulnaris. So the pronator teres is lateral most. Flexor carpi ulnaris is medial most. You can see here all superficial flexor muscles of forearm are arising from anterior aspect of medial epicondyle of the humerus called common flexor origin. From lateral to medial, pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, flexor carpi ulnaris. First, let's see origin and insertion of these muscles. Pronator teres, it is smallest and most lateral of the superficial flexors of the forearm. Origin, it arises by two heads, humeral head, ulnar head. Humeral head, it arises from medial epicondyle of humerus. Ulnar head, it arises from medial margin of coronoid process. Ulna have olecranon process and coronoid process. It arises from medial margin of coronoid process. Origin, it arises by two heads, humeral head, medial epicondyle of humerus, ulnar head, medial margin of coronoid process. Insertion, it inserts on middle one-third of lateral surface of radius. This is ulna, this is radius. This is lateral surface of radius. It inserts on middle one-third of lateral surface of radius. Flexor carpi radialis, origin, medial epicondyle of humerus. Insertion, base of second and third metacarpals. You can see these are second and third metacarpals. It inserts onto anterior aspects of base of second and third metacarpals. It arises from medial epicondyle, inserts on base of second and third metacarpals. Palmaris longus, origin, medial epicondyle of humerus, insertion, flexor retinaculum and apex of palmar aponeurosis. The tendon of palmaris longus passes superficial to flexor retinaculum and is attached to distal part of it, and it is also inserted on apex of palmar aponeurosis. Palmaris longus, origin, medial epicondyle of humerus, insertion, flexor retinaculum, apex of palmar aponeurosis. Flexor digitorum superficialis, it is largest muscle of superficial flexor muscles of forearm. It arises by two heads, humero-ulnar head and radial head. Humero-ulnar head, it arises from medial epicondyle, medial collateral ligament, medial margin of coronoid process. Same as that of pronator teres, it also arises from medial margin of coronoid process. Humero-ulnar head, medial epicondyle, medial collateral ligament. Medial collateral ligament is also known as ulnar collateral ligament. It also arises from medial margin of coronoid process. You can see here it arises from medial epicondyle, medial collateral ligament, medial margin of coronoid process of ulna. Radial head, it arises from anterior oblique line of radius. Anterior oblique line of radius. Origin, it arises by two heads, humero-ulnar head, radial head. Humero-ulnar head, medial epicondyle, medial collateral ligament, medial margin of coronoid process. Radial head, anterior oblique line of radius. Insertion, muscle is divided into four tendons. Each tendon is divided into two slips. You can see here each tendon is divided into two slips. These slips are inserted on middle phalanges of medial four fingers. This is metacarpal, proximal phalanx, middle phalanx, distal phalanx. Each tendon divides into two slips which are attached to sides of middle phalanges of medial four fingers. Insertion, middle phalanges of medial four fingers. Flexor carpi ulnaris, it is medial most of the superficial flexors of the forearm. Origin, humeral head, ulnar head. Humeral head, it arises from medial epicondyle. Ulnar head, it arises from medial margin of olecranon process, upper two-third of posterior border of ulna, medial margin of olecranon process, upper two-third of posterior border of ulna. Insertion, it inserts on pisiform bone. It inserts on pisiform. The insertion is prolonged to hook of hamate and base of fifth metacarpal. The insertion is prolonged to hook of hamate through pisohamate ligament. The insertion is prolonged to base of fifth metacarpal through pisometacarpal ligament. Out of the 5 muscles, 3 muscles arises by 2 heads. Pronator teres, flexor carpi ulnaris, flexor digitorum superficialis. Whereas flexor carpi radialis and palmaris longus arises by only 1 head. Pronator teres, it arises by 2 head, humeral head or superficial head, ulnar head or deep head. Humeral head, medial epicondyle, ulnar head, medial margin of coronoid process. Insertion, lateral surface of radius, middle 1/3. Flexor carpi radialis arises from medial epicondyle, insertion, base of second third metacarpals. Flexor carpi ulnaris arises by 2 heads, humeral head, ulnar head. Humeral head arises from medial epicondyle of humerus. Ulnar head arises from medial margin of olecranon process and upper two-third of posterior border of ulna. Insertion, it inserts into pisiform bone. The insertion is prolonged to hook of hamate and base of fifth metacarpal. Flexor digitorum superficialis, 2 heads, humero-ulnar head. Humero-ulnar head from medial epicondyle of humerus, medial collateral ligament, medial margin of coronoid process, and radial head from anterior oblique line of the radius. Insertion, middle phalanges of medial forefingers. Palmaris longus origin, medial epicondyle of humerus. Insertion, flexor retinaculum, apex of palmar aponeurosis. All arises by medial epicondyle. Ulnar head of pronator teres arises from medial margin of coronoid process. Flexor carpi ulnaris, ulnar head arises from medial margin of olecranon process and upper two-third of posterior border of ulna. Flexor digitorum superficialis, humero-ulnar head from medial epicondyle, medial collateral ligament, medial margin of coronoid process. Same as that of ulnar head of pronator teres, medial margin of coronoid process, and radial head from anterior oblique line of the radius. Now let's see about nerve supply and action of these muscles. Nerve supply. All these muscles are supplied by median nerve except flexor carpi ulnaris. Flexor carpi ulnaris is supplied by ulnar nerve. All these muscles are supplied by median nerve except flexor carpi ulnaris, which is supplied by ulnar nerve. Actions: pronator teres, pronator, pronation of forearm. Its main action is pronation of forearm. It also helps in flexion of elbow. Flexor carpi radialis. It causes flexion and abduction of wrist. It causes flexion and abduction at wrist joint. Palmaris longus. It causes flexion of wrist. Flexor digitorum superficialis. It flexes middle phalanges of medial forefingers. Flexor digitorum superficialis. It flexes middle phalanges of medial forefingers. Acting more strongly, it also causes flexion of proximal phalanges and wrist joint. It also causes flexion of proximal phalanges and wrist joint. Flexor carpi ulnaris. It causes flexion and adduction of wrist. It causes flexion and adduction at wrist joint. Pronator teres mainly causes pronation of forearm. Flexor carpi radialis causes flexion and abduction at wrist joint. Palmaris longus, flexion of wrist. Flexor digitorum superficialis. Its main action is causing flexion of proximal interphalangeal joints of medial forefingers. Flexor carpi ulnaris causes flexion and adduction at wrist joint.